Hi, my name is Megan Polson, and I'm taking the online child psychology class. And today I'm going to be talking about developmental delays and how to spot them in your children. And the setting is going to be a parenting class. Developmental delays by Megan Polson. All right, so which child has the developmental delay? They're all happy, and the point is that you can't tell. You can't always tell when a child has a developmental delay. Sometimes it's just not present on the outside. So what exactly is a developmental delay? A developmental delay is when a child is less developed mentally or physically than is normal for their age. Developmental delays come in a variety of forms. Some examples of common developmental delays include things that you've probably heard of: autism, Down syndrome, but you may not realize that it also includes things such as hearing impairments, speech impediments, etc. What causes developmental delays? Developmental delays can have many different causes. One cause could be genetic, such as Down syndrome, that's a genetic developmental delay. Another may be complications of pregnancy and birth, for example, prematurity. Prematurity in infants can lead to developmental delays further on, and social factors such as poverty and behavioral factors such as child neglect or abuse, while they don't necessarily cause developmental delays, it does put children at a much higher risk for them. Often, however, the specific cause is unknown. Speech and language delays. So red flags to look for to watch out for speech and language delays are if a child does not respond to loud noises, does not babble at a young age, and if by 2 they cannot speak at least 15 words. Ways to promote healthy development are to read to them daily and communicate with your child by talking, singing, just engaging with them. Motor skill delays. Red flags to look for in this category include that if your child does not reach for or hold objects, cannot sit up without help by 6 months old, or has trouble getting objects to their mouth. Ways to promote healthy development in this area are to encourage gross and fine motor skills. You can do this by implementing toys that promote gross and fine motor skills, and just active play and getting them outside running around on a jungle gym is a great way to promote gross motor skill development. And a way to help remedy this if they did have a motor skill delay would be physical or occupational therapy. Social and emotional delays. Red flags to look for is if your child shows no affection towards caregivers, won't imitate facial expressions by 9 months old, does not laugh, or just generally doesn't show emotion. Ways to promote healthy development in this area would be just caring for your child, showing affection regularly, and periodically introducing new people to your child and comforting your child. Just being that emotional support system for them and not neglecting them. Cognitive delays. Some red flags to look out for is if your child does not point to objects or pictures by 1 year old, does not use gestures, does not know the function of common objects such as toothbrush, hairbrush, spoon, telephone, etc. by 2 years old. Ways to promote healthy development are to actively engage your child with many forms of stimuli, as long as it's not too much at one time. So just a variety of things that would get them mentally engaged. And the thing that best combats cognitive delays is just early intervention. And I'll go more into early intervention in a second. The importance of early intervention. So a child's brain is still relatively plastic during the first 3 years of a life, which means that it just has more room for flexibility. As a child ages, it becomes increasingly more difficult to enact meaningful change. So that's why early intervention is so important. Just as soon as you're seeing these signs and contacting your doctor, getting involved, because the earlier the better. The environment a child is exposed to can either... The importance of early intervention. The first and foremost, I think personally the most important reason, is because a child's brain is still relatively plastic, meaning flexible, during the first 3 years of life, as a child ages, it becomes increasingly more difficult to enact meaningful change. So the earlier that the intervention is put in place, the more effect it'll have in the long run. A second reason is that the environment a child is exposed to can either positively or negatively impact their development. So getting involved with that early intervention and suiting the environment to the child's needs really does help as well. A third reason is that the brain is strengthened by positive early experiences, especially stable relationships with caring and responsive adults, safe and supportive environments, and appropriate nutrition. The importance of early intervention continued. Early social/emotional development and physical health provide the foundation upon which cognitive and language skills develop. So that early intervention, setting the record straight early, getting good habits in place will help the child a lot in the long run. High quality early intervention services can change a child's developmental trajectory and improve outcomes for their children, families, and communities. Intervention is more effective the earlier it is implemented. So early intervention really is key. Just some closing thoughts. Remember that each child develops at his or her own pace, and the range of normal is quite wide. So even though those red flags are there, and if you should contact your doctor if you see them, just know that some kids just don't walk at the same time. Some of them could take a little bit longer, some do it faster. It's totally normal for the most part. It's just when it starts getting excessively out of that range that you should contact your doctor and make sure everything's okay. Even though a child may be developmentally delayed, their potential is still limitless. Offer them a variety of ways to express themselves. Some kids thrive in art and music. Some are more their brain is more wired for math and writing, sports, etc. There's just because your child is developmentally delayed has no impact on their potential for success in the future. And what's most important is the child's happiness and well-being. And there's my works cited. Thank you very much.